chunky.
Hey you guys, I am excited to announce that today is my post-op appointment for my knee surgery. So I'm heading in now and I will update you on what's going on. Okay, so as I mentioned, I'm coming in for my post-op. It's been 7 days since surgery. My dogs love to go for car rides. So I brought them with me. They'll sit in the car while I'm inside, happily, people watching and barking at anybody who comes around the car. I've got all of these really cool photos from the orthoscopic surgery, so I'm bringing those in, and I might do like a, it's not really blood and guts because it's all tendons and it's all like white inside of my knee photos, but maybe I'll show you guys those in the next part of this video. So I'm gonna head in now. That's Luna, by the way. She's my perfect little angel cookie, and then in the way back there's Max. He is also a very good boy, but he's a rescue, so he's got a little bit of barking issues if you guys haven't ever met him before. Okay, cool. So I'm gonna mask up and head in, and I'll see you guys later. So a little insider secret, by the way, if you ever have to get anything like knee or foot or whatever done, wear shorts, because the ones that they have at the orthopedic center are like the most ridiculous hospital surgery, like gauze, paper, like one size fits all, ridiculous things. So I finally wised up. I mean, like, I've been seeing the same ortho since I was like 15, so it's been a minute. I finally wised up. It's kind of cold outside, wearing a hoodie, but living my best life. Biker shorts and Uggs. Okay, so part of what's happening today is that I'm getting the sutures from the stitches that were put in taken out. One of the sets of stitches I actually did pop while I was teaching a few days ago. I think it was on Monday. So I've got some like wound closure and like butterfly stickers on it, but the other ones are coming out, so. All right, bada boom, bada bing. Stitches are out, and it looks pretty good for 8 days post-surgery. I've been told that I shouldn't do anything too vigorous for probably another 2 weeks, but that everything is healing nicely. My knee is still kind of swollen, and my calf a little bit uncomfortable, but he basically said that in order to get rid of the swelling, a great idea is to get, if you guys have ever seen like runners with the compression socks, he was saying to get some of those, but they actually have like medical grade ones that exist, and you can get the ones that either go up to like the knee, which the concern is that that's exactly where the swelling is and it might make my knee more swollen, but they actually make ones that are all the way up to your thigh. So thigh high compression socks, this is pretty exciting stuff. So I am going to find my car in this parking lot, wherever it is. I wonder if I'm getting too distracted with talking to you guys. If I were my car, where would I be? Oh, here we are. Puppies! So I'm gonna go to the drugstore and get myself some thigh high, oh yeah, compression stockings. Puppies! They're just chilling. They like straight up don't even care that I'm back. But yeah, moving good, living life. He said that literally in the past 25 years since he's been doing these kind of knee surgeries that he's maybe had to do like 5 rescopings. So after my knee is healed, it's like smooth sailing. I'm good. So pretty exciting. Once I get my thigh high stockings, I'm going to show you guys about it because I think it's going to be extremely dorky. Which basically means it's an exciting thing to see somebody else doing and kind of an embarrassing thing to share with other people. But it is what it is, and I want to share this like healing experience. So I'll check back in a little bit. All right. Okay, you guys, I got it. Bam. I'm living my full 90s fantasy, except for that I feel like the smoothness that is like on her leg right here between the compression sock and her leg is not what it's gonna look like when they actually get on. Also, yes, they did not have them in black, so white is the only thing. And I wish that I had like a rando little plaid skirt to wear when I put these on later, and some like Mary Janes, because it's gonna be silly AF. All right, stay tuned. All right, you guys, this is pretty thrilling stuff. Just got home. Max is here, Luna is outside still, and we're gonna try out these 3M Futuro anti-embolism thigh stockings designed for post-operative patients. Okay. Get a little plant out of the way and check out the situation here. Kind of is really giving me 90s vibes. I mean, they really kind of just look like stockings. I guess I don't really need to put both of them on. It just occurred to me that I don't need to wear both of these. That's kind of hilarious. But I am gonna sit down while I put this one on. So let's see here. I mean, I guess maybe I'll look like a cool sports player or something like that. Oh, okay, there we go. I wasn't sure if it was actually gonna be like tight enough, if it was really gonna do anything. But it does, I am starting to feel some compression now that I'm getting closer to the bottom. Which means once I pull it up, it'll definitely be compression because, you know, my leg gets bigger from the foot to the thigh. Sometimes, I don't know if you guys get this or not, but like, this is some old lady shit. Maybe it's just a tall girl thing, but ever since I was like pretty young, when I fly, my legs really hurt from sitting and like the pressure. Oh my goodness. Oh wow. Oh wait, is this supposed to be where the knee goes? No. What? I'm just confused. There's like a seam here, but I'm confused about what that is supposed to do. Anyway, when I fly, my like knees and my legs always like really hurt afterwards, especially if it's like a long flight. So I don't know if maybe these will become part of my repertoire when I do that kind of thing. Yeah, I mean, it's not as bad as I thought it was gonna be. It's definitely pretty dorky. It's got some like reinforcement around the arch of the foot. There's another sort of pad here. I wonder if that's supposed to be like extra compressive for your ankle. There is some swelling down into my ankle. Like I had socks on earlier. When I took them off, there was definitely like a pretty hardcore line, which is in part due to like maybe being a little bit dehydrated. I've been teaching in the infrared room a lot more recently, so I need to maybe be drinking more water. But you can see it's really hard to tell. So even if I brought it close to you guys, you probably wouldn't be able to tell. But there's definitely like a little bit of variation in the stocking as if this was the top of a sock. So maybe I haven't pulled up too high, I don't know. There's not really like a picture that tells you how to pick which size. I got medium, I think. Yeah, I got medium, unisex medium. I am 5'11" and like 150 pounds, so graduated compression speeds blood flow by providing the most compression at the ankle and gradually diminishing the pressure up the calf. Helps reduce the inflammation or the formation of blood clots. Durable. Anyway, there we go. See, like there's this seam right here, but I don't really think that's supposed to go over your knee. I mean, in this picture, it really does look like it goes up pretty high. Is it supposed to go in the back? Do I have them on backwards? Upside down? Does that go on the inside? Is it because your inner thigh is like not as... Why doesn't it tell me how I'm supposed to have this thing? Why isn't it telling me where this weird line is supposed to go, you guys? There's a little card in here. Wear instructions. Insert hand into heel pocket of stocking. Turn stocking inside out by grasping the center of the heel. Position stocking over the foot. Gradually pull it up. Yeah, I mean, I guess in this little line drawing, this little situation is in the front. So if you like look really, really carefully, it does look like there's this kind of little thing right there, which leads me to believe that I do have it on right. So I'm gonna chill for a little bit. Hopefully this will take down some of the swelling in my calf, ankle, knee. And it'll send this swelling fluid up to be metabolized and peed out. It's one of the reasons. So just to give you some reference as to like, it's not just that I'm vain and I don't want my knee to be swollen anymore. It also is keeping me from bending my knee all the way because there's extra fluid in my knee right now from the swelling. So I've been doing lots of turmeric and hopefully I can get some of this swelling to go down so that I can bend my knee all the way. That's all my information. I am glad you guys hung out with me. If you enjoyed this weird video about post-op surgery and compression, stocking, fantasy, 90s, whatever. Okay, I'll see you guys later. Peace.